our dear colleague, the sponsor of the measure, would yield to some clarificatory questions from this representation, Mr. President.
Very gladly, Mr. President, to the good gentleman.
Thank you, Mr. President, distinguished colleague. Let me also put into the records of this August chamber that I am in full support of this measure, and we feel that it is important that we ask some questions to strengthen our position and to ensure that this measure is indeed needed, and that this measure is a important piece of legislation. May I first start by saying, Mr. President, that when the COVID-19 pandemic exposed critical gaps in our healthcare facilities, ebidensya po dyan yung overwhelming situation in our hospitals, yung lack of hospital beds, at the height of the pandemic, yung emerging threats such as more recent, Mr. President, like what's we have been experiencing right now, the threats of Nipah virus that underscores the need for preparedness. And of course, our people need to be reassured that when such emergencies arise, our hospitals will be adequately equipped to absorb sudden increases in patient volume without, again, emphasizing and compromising yung pong service and care. So may we know from the good sponsor, Mr. President, that, how does this proposed measure future-proof this new policy that seeks to improve the capacities and the capabilities of our health facilities?
Salamat, Mr. President. Isa po sa mga paraan kung papaano itong bill ay nag-future-proof ng ating universal healthcare system at yung kalusugan ng ating mga kababayan ay dahil minamandate nitong bill na to yung development at saka maintenance ng Philippine Health Facility Development Plan bilang strategic blueprint sa pagmo-modernize ng mga hospital infrastructure at services nationwide. Ito pong PHFDP po enables access to capital outlay investment and ensures the alignment of hospital expansions with national health facility planning and investment priorities. So ibig sabihin po, itong bill ay kinokonteksto dun sa isang longer term and therefore strategic plan na tinitignan paano talaga fully isa-set up yung infrastructure at ima-match yung health services including sapat na bilang ng mga ospital at sapat na bilang ng mga beds mismo for the Philippines moving forward in time, Mr. President.
Thank you, Mr. President, distinguished colleague. Matagal na po na napag-uusapan dito sa bulwagang ito na tuwing tayo po ay magbibigay ng o tatalakayin yung mga panukalang batas para increase yung bed capacity. Lagi yung nasasabi, kaka-increase lang nitong isang araw, nung isang Congress, ngayon increase ulit, etc. But then, hindi na ipapaliwanag ng gusto kung bakit ho ganun. Kasi nag-i-increase din ang volume ng ating patients, nag-i-increase ang ating population. And so, kailangan talaga na mas maging sensitive tayo doon sa pag-increase ng bed capacity. And as a concrete example, Mr. President, distinguished colleague, and taking off from the experience, our experience during the COVID-19 pandemic, will the Department of Health include health emergencies and emerging diseases in determining and authorizing increases in hospital bed capacity in hospitals across regions, Mr. President?
In a way, Mr. President, opo. Dahil yung isang basehan mismo ng Philippine Health Facility Development Plan at yung bill na ito ay yung burden of disease sa bawat lokalidad. So kung nag-figure na po sa isang lokalidad or maraming lokalidad sa ating bansa, yung mga emerging diseases, yung mga new diseases, then opo, mag-figure din po iyan sa pagpaplano sa ilalim ng PHFDP at ng bill na ito tungkol sa bed capacity, Mr. President.
Maganda pong nabanggit nyo yung plano, no? Yung Philippine Health Development Plan. And to better understand, Mr. President, distinguished colleague, yung kahalagahan nitong panukalang batas na ito. Pwede ho bang malaman, just for the record sa ating sponsor, ano ba yung estado ngayon ng ating mga pasilidad sa bansa, Mr. President? Siguro, Mr. President, yung magandang maitanong, yung hospital ratio siguro, no? Yung hospital bed to population ratio. And matanong na rin natin sa ating colleague, ano ba yung ideal na ratio, no? When we talk about hospital bed to population ratio, Mr. President?
Mr. President, may ideal nga at ito po ay sinasabi ng Department of Health ang target na 2.7 beds per 1,000 population. Pero wala pa po talaga tayo sa ganoon, Mr. President, in absolute terms. Halimbawa, as of June last year, 2025, mayroon lamang ang gobyerno na 60,395 hospital beds na nagtatala po ng 114,251 bed capacity gaps. Kung titignan po natin yung kabuang kalagayan ng mga DOH hospitals, kaugnay ng usapin ng bed capacity, sa kasalukuyan, Mr. President, mayroon pong 94 public hospitals sa ilalim ng Department of Health. 78 po dyan ay functional, 4 ay government-owned and controlled, 10 pa po ay mga bagong ospital na itatayo pa lamang, 1 po ay management office pa lamang, yan po yung Philippine Cancer Center, at 1 pa po ay ongoing ang conversion bilang DOH hospital. Yan naman po yung Freeport area of Bataan General Hospital. Meron ding yung 10 bagong ospital na itatayo pa lamang ay pwede ko rin pong i-enumerate kung ninanais ng good gentleman. At sa lahat po ng mga ospital na ito, on average, ang current occupancy rate po ay 136%.
Wow.
So, over 100%, way above yung rekomendadong 80 to 85% lamang. Kung kaya nga't yung mga government hospitals natin po ay natural, overcrowded, understaffed, at saka under-resourced. At ito po ay nagre-resulta sa mga masasamang resulta, longer waiting times, treatment delays, overcrowding, Mr. President, weak emergency and disaster response. Tinanong po ng good gentleman from Bulacan kanina yung emergency, to name a few. At bilang apex or end referral hospitals within the healthcare provider network, syempre po, ito palang bed capacity gap sa DOH hospitals nag-i-impact na po sa buong implementasyon ng UHC Act of 2019.
Salamat po at mas maliwanag ngayon sa pananaw ng ating mga kababayan kung bakit napakahalaga nitong batas po na ito. I'm looking at the figures that the distinguished sponsor mentioned a while ago. So it appears now that the ideal would be 2.8 beds per 1,000, but right now it looks like we're not even hitting the 1 bed per 1,000, Mr. President. Is that a correct assumption?
Way less than half, Mr. President. Tama po.
Tama. Salamat, Ginoong Pangulo. Mr. President, let me go to another point. Yung hospital bed capacity is closely linked to capital availability and local resources, no? At nagre-resulta po ito in regional disparities. In fact, areas with lower poverty incidence generally enjoy higher bed to population ratios, while the poorer regions remain underserved. Tinitingnan ko po itong National Health Facility Registry at yung huling data is sa 2024. Pinapakita po, for example, that Batanes has the highest hospital bed density, higher bed to population ratio, while the Dinagat Islands recorded the lowest. At in further looking at the analysis of the PIDS hospital statistical report, it indicates chronic overcrowding in public hospitals. And this is largely driven by insufficient capital investment. So, ang tanong ko lang, Mr. President, paano po, have we mapped this data up to the local level para po malaman natin kung anong locality, anong rehiyon yung dapat ay i-prioritize po natin. Otherwise, Mr. President, there might be the same addressing of concerns sa gusto nating ma-accomplish, Mr. President.
Unfortunately, Mr. President, the best we can do for now is provincial level. Pero dahil kahit ito pong pagtukoy ng mga probinsya na wala pang DOH hospital, and mind you, Mr. President, 36 sila out of the 82 provinces. At salamat sa pagbanggit ng good gentleman from Bulacan sa Dinagat Island, isa po siya sa mga probinsya sa Region 13 na wala pang DOH hospital. But since nga po, natukoy na itong 36 provinces na walang DOH hospital sa loob ng Philippine Health Facility Development Plan, pwede po nating hingiin sa DOH. Mas idetalye pa po nila ang pagpayo sa atin dito sa Senado o sa buong Kongreso. Ano yung mga gaps down to the local level, Mr. President.
Salamat, Ginoong Pangulo. At I was just told, Mr. President, by Senator Amy, that even the great province of Laguna, wala din pong provincial hospital, Mr. President. Kaya,
Actually, Mr. President, i-check ko po sa DOH, baka mali yung datos ng department. Dahil sa informasyon
But right
na meron
now,
po
36,
ako,
Mr. President.
Region 4A ay isa sa mga rehiyon na ang lahat, di umano, ng mga probinsya ay may DOH
meron.
hospital. So i-double check ko po yung datos
yes,
ng DOH.
thank you, Mr. President. I cannot